I, Dr. Narendra Singh, the President of International Society of Herbal Medicines and Director, International Institute of Herbal Medicine, are working on herbal since half a century. Most of the Indian population suffers from bowel problems. Basically, there is constipation, diarrhea, amoebic dysentery, and bacterial dysentery, and various kinds of other ailments like giardiasis is very common in Indian population because of the pollution through water systems and open food materials. These cause various diseases of the abdominal system. And when the constipation, diarrhea and these things become chronic and remain for long periods, it is associated with a condition where abdominal pain, at the same time mental problems occur. Because of the irregular bowels, the individual gets either anxiety or suffers from depression. Then this clinical condition is known as irritable bowel syndrome. For this we have designed a formulation known as Bowel Care. The name itself signifies that it can take care of all kinds of symptoms and disease of the bowel systems. It is particularly designed out of organic herbs which are free from toxic chemicals and harmful pathogens. Bale leaves, chandrasur fruits and isabgol. These are the three contents. But the major content is bale leaves, which is antibacterial and soothing to the abdomen, and small amounts of isabgol and chandrasur have been added as to form a protective layer on the mucosa of the intestine. It is very good for hyperacidity, peptic ulcers, or ulcers in the intestine caused by amoebiasis. It produces only a protective layer, thin layer on the mucosa for healing of ulcers and other conditions. It is not a laxative like isabgol because the small doses produce only a protective layer. So it should be clear that we are not using it as a laxative, we are using it as a controller of the all bowel system ailments. It is very effective both in constipation and diarrhea as well as very good for intestinal bowel or irritable bowel syndrome. Also helpful in other conditions of the bowel. We recommend that one should take regularly 1 or 2 capsules taken twice daily for long periods because most of the conditions of the bowel are chronic.